Patients think they are freely choosing hospitals.
But many of us are beginning to ask difficult questions.
Are digital healthcare platforms or aggregators like Medibuddy, Pristyn, etc. truly remaining neutral in their healthcare recommendations and partnerships?
Are treatment pathways being influenced?
Across specialties, patterns are being noticed.
Patient routing?
Platform-driven referrals,
Insurance-linked treatment pathways.
Non-clinical influences in medical decisions.
And growing dependence on intermediaries.
I always wonder why some hospitals receive disproportionately higher approvals as compared to other hospitals, and also why do the approval pathways differ across hospitals?
Why are patients being redirected after the initial contact?
why are some procedures being packaged transactionally?
Patients deserve clarity.
Doctors deserve ethical systems.
And insurers deserve transparency.
Medicine cannot become algorithm-driven commerce.
Professional autonomy must remain protected. And patients' trust must remain central.
Insurance systems work on risk pooling.
Higher payouts eventually affect everyone.
Cost inflation enters the system.
The downstream burden reaches the patients.
Premiums don't rise in isolation.
They rise because systems absorb costs
and eventually redistribute them.
The patients may not realize this,
and it will affect long-term affordability,
especially for middle-class families.
Healthcare platforms can be useful. Technology itself is not the problem.
But opacity is.
Lack of transparency is.
And unclear influence over care pathways.
Ethical medicine requires independence.
Not invisible incentives.
Not directional steering.
Not distorted competition.
And not erosion of trust.
We are not making accusations.
We are asking questions.
We are sharing these observations. We have also approached the relevant authorities for further review.
We are asking for transparency.
Some people compare this to Swiggy and Zomato. But healthcare is not food delivery.
The patient is not an online order, and a surgery is not a marketplace transaction.
Convenience cannot replace ethics. Because healthcare must remain patient first.
Hey everyone! Have you ever opened a digital healthcare app, kind of marveled at how incredibly easy it is to book a procedure and thought, wait, how does this actually work behind the scenes? Well, welcome to This Explainer. Today, we're going to unpack a super fascinating hypothetical scenario that reveals how the incredible convenience of digital healthcare platforms might actually be secretly jacking up your insurance premiums. It's a massive question, right? What exactly happens when the frictionless, one-tap convenience of a digital app collides head-on with traditional medical ethics and insurance protocols? So, today, we're putting on our investigator hats. We're going to follow a single, hypothetical patient's journey right through a modern digital healthcare ecosystem to uncover a major potential systemic flaw. And spoiler alert, it's one that could be costing honest patients and ethical doctors an absolute fortune. Section 1. The patient's hypothetical journey. Okay, let's dive into this. Meet our fictional protagonist, Mr. X. He's a 26-year-old software professional, spends literally all day staring at screens, and he's decided he wants corrective eye surgery, LASIK. Now, not because he's functionally disabled by his vision, but purely for the convenience of tossing out his glasses forever. He has mild myopia, specifically a prescription of minus 2.00D. Now, in the real world of insurance, policies normally deny cashless approval for mild refractive errors like this. They just consider it an elective, cosmetic choice, rather than a medical necessity. Mr. X knows this, but, instead of giving up, he just pulls out his phone. Now, as we trace this timeline, notice how Mr. X completely bypasses calling a local hospital directly. Step 1, he shoots off a query through a digital health app after seeing an online ad. Step 2, the platform immediately guides him, actually promising they can help process his case under insurance. Step 3, they send him to a very specific partnered hospital. And step 4, boom, the paperwork is rapidly sent to the insurance processor. I mean, it seems absolutely seamless, right? But there's a whole lot hiding in the shadows of this digital detour. Section 2, the platform intermediaries. So to really understand how a typically denied surgery magically glides toward an approval, we've got to look at the invisible players operating right in the middle of this transaction. First up, let's look at VisionBridge. That's our fictional online healthcare aggregator. Think of them as the fixer. They collect the patient leads and they direct the traffic. But, this brings up an absolutely critical question. Is this app actually acting neutrally? When they sent Mr. X to a specific hospital, was it because it was genuinely the best clinical choice for him, or are there hidden financial incentives and operational relationships secretly dictating that routing? Next, we have AssistCare TPA, our fictional third-party administrator. They are essentially the system's gatekeepers. Their entire job is to sit right between the insurance company and the hospital, review the medical paperwork, and decide whether to grant or deny the cashless surgery. Meaning, the insurance pays directly so the patient pays nothing out of pocket, strictly based on the policy rules. The catch? They rely entirely on the authenticity of the documents handed to them. Section 3, the problematic pathway. So, the crucial point is, how does a mild, non-eligible case actually get past that gatekeeper? How does a medical denial magically become an approval in this hypothetical ecosystem? Let's take a look under the hood here. In our educational scenario, for the surgery to get the green light, the hospital would hypothetically have to manipulate the documentation. This could involve creating retrospective refractive records that make the vision problem look way worse than it actually is, or modifying historical progression patterns, or even generating scans that are totally inconsistent with the actual clinical findings. They take this manufactured proof, upload it, and satisfy the insurance criteria. Now, while this is just a hypothetical example, it is vital to note that this kind of conduct raises severe real-world concerns regarding ethical medical practice, documentation authenticity, and, let's be honest, outright insurance fraud. Section 4, the systemic ripple effect. Because actions like this, they never exist in a vacuum. Let's follow the money and look at the immediate fallout here. At first glance, this little hack of the system looks like an absolute victimless crime. It looks like a win-win-win. The patient is absolutely thrilled because they get their cashless surgery. The hospital is happy because, they gain increased procedural volume and revenue. And the tech platform celebrates because they achieved a successful conversion and get their cut. Everyone wins, right? Well, whenever money is moving, someone is always left holding the bag, which forces us to stop, take a serious look, and ask, who actually pays for this seemingly perfect, frictionless transaction? Who is the hidden, long-term victim of this exploit? The answer actually lies in how insurance mechanics work. You see, insurance relies entirely on pooled risk. When non-eligible claims are successfully forced through the system, the payout burden rapidly escalates. And insurance companies, they don't just absorb those losses out of the goodness of their hearts, they recalculate the risks. And the result? Rising insurance premiums, reduced affordability, and way stricter barriers for everyone else. Ultimately, it's the honest patients, the ethical doctors, and everyday middle-class policyholders who suffer the massive financial blow of a system stretched right to its breaking point. Section 5, the ethical conflict. But beyond the financial strain, there is a much deeper philosophical issue at play here. And this brilliantly illustrates that we just cannot treat healthcare the exact same way we treat food delivery or e-commerce. Think about it. An e-commerce app is purely transactional. It's built for marketplace optimization. But medical decision-making? That requires independent judgment, profound ethics, long-term patient accountability, and heavy medical legal responsibility. A tech platform simply does not carry the same ethical burden as a treating doctor. When we start normalizing these ethically ambiguous, volume-driven models pushed by platforms, the medical profession takes a massive, massive hit. We start seeing a real erosion of independent clinical culture. Younger practitioners end up facing immense commercial pressure to just push volume. And most dangerously, it leads to a total decline in trust. I mean, the historical foundation of medicine is credibility and professional integrity. If the public starts perceiving that medical decisions are being heavily influenced by the financial algorithms of some app, that sacred trust is broken. Section 6, Protecting Healthcare Integrity. So, how do we fix this? To prevent this hypothetical disaster from becoming our everyday reality, insurers, TPAs, and regulators absolutely need to step up their oversight. We have to ask the tough questions. Are we actually auditing these surgery approvals and verifying retrospective records? Are TPAs ensuring referral neutrality? Should these digital platforms undergo rigorous audits themselves? And perhaps most importantly, should hospitals be legally required to transparently disclose their financial relationships with these intermediary apps? Because at the end of the day, the central concern here is transparency. Asking these tough questions is definitely not an attack on digital innovation, or telemedicine, or modern convenience. We all love tech, but healthcare systems only function sustainably when clinical judgment remains fiercely independent, when medical documentation is completely authentic, and when patient choices aren't secretly biased by an algorithm. As technology continues to integrate into absolutely every facet of our lives, the big question is this: will our healthcare systems adapt to preserve trust, affordability, and integrity in the digital age? Or will our endless pursuit of convenience ultimately compromise the very care we rely on? It's something we all need to be paying very close attention to. Thanks for joining me on this explainer, and keep asking the right questions.